Well, the deadline for health insurance companies to set their 2018 premiums just passed, and they're going way up. Some insurers even saying that prices could skyrocket up to 20%. Here to discuss is Chair of the Program in Business and Finance at the King's College in New York City, Brenberg. Thank you so much for joining us.
You bet. Good to be here.
So the implications of setting these rates and the deadline, what if they did not do it, and why do they need to do it at this point?
Well, this is the time you file because people are going to have to start enrolling for 2018. So insurers have to say, here's what you're going to pay for an insurance policy next year. And the bad news, just like last year, is rates are going up probably at double-digit rates. Once again, consumers are getting hit. These are the consequences of not getting Affordable Care Act repeal or replace done this year.
So should we have expected anything else?
Nothing else, no, because the economics haven't changed. Young people, healthy people don't want to buy coverages they don't need. They don't buy them. That drives premiums up for everybody else because the pool of insureds gets sicker and more costly, and that death spiral just continues. And we're seeing that 20% increases this year on the back of double-digit increases last year. That's huge increases for consumers.
Let's take a look at some of those healthcare premium increases specifically. These are the highest. You can take a look at Delaware, which is an increase of 49%.
Yep.
And then New Mexico, an increase of 34%. Virginia, 33%, and then it goes down from there.
And these are just early projections, by the way, because these rates still have to be approved, but we're getting a sense for how big the increases could be. And by the way, they could be bigger because there's still all this uncertainty around cost-sharing subsidies. Insurers don't know if they're going to receive those subsidies this year. If they think they're not going to, the rates could be even higher. So we're just seeing kind of the baseline right here.
Which President Trump has threatened to not do.
He approved it for August, but we don't know what's going to happen going forward. All of that uncertainty means higher costs for consumers.
And when you say approve these rate increases, how does that work? Who has to do that?
So state insurance regulators have to approve these rate increases. They'll look at it and say, is this fair given the cost that these insurers incur? And the problem is they don't know either because they don't have an answer on these cost-sharing subsidies. So the bottom line is when you have uncertainty in insurance markets, prices always go up, and that's exactly what we're seeing
So what can people possibly do?
Well, they should, I think the biggest thing is they should be pushing their lawmakers to say, we can't afford to fail on health care reform. You missed it this summer. You need to go back to the drawing board. The problem is Congress has put itself in a bind because it has so much to get done now.
September alone, they have 12 working days, and I think 6 of those are travel days, fly-in, fly-out days, and they have such a long list of what to do on top of Hurricane Irma that's moving in.
The world keeps
didn't
getting
count
more
on Harvey.
Yes, North Korea. So this is the problem. But look, Congress has to act because people can't afford to. This is like another mortgage payment for people. You can't afford to pay that. Something has to change. Congress has to go back to the drawing board.
The government should not be any different. We have to pay our bills. We have to stay on a schedule. They should do the same.
Yep, and you have to hold them accountable to do that.
Thank you, Brian. Appreciate it.
Good to be here.